What's up, guys? Dr. Jared Hall here. And tonight I wanted to talk about a topic that is a really difficult topic to talk about sometimes, but it's one that I see a lot of really young clinicians especially struggle with, and it's something I still struggle with myself. Um, you have to take a step back and realize that you can't measure your own success as a clinician by the objective outcomes and the success of your patients. You can't measure your own self-worth as a clinician by how much better your patients get. There's so many factors that go into getting a patient better, and some of that might be your demographic. You might work with a demographic that's a little bit more difficult than other clinics. You might have a high proportion of chronic pain. You might have patients that have a lot of comorbidities. That particular patient that's in front of you might only be giving you 5% while you're giving 95%. And I know that's hard to admit sometimes, but if you are constantly doing that, it's the quickest way to lead to burnout, and that's that many more people that you won't be able to help in the future if you do become burnt out. And a lot of times maybe that particular patient at that time is not in their readiness to change state. Maybe their frame of mind right now isn't willing to grasp onto what you're telling them right now that might be the best thing for them. But you have to measure your own success by how well you adhere to the best evidence, the best guidelines, treating in the best possible way that you know how to treat at that particular time or at this particular time in your career. And you have to hang your hat up at the end of the day knowing that you gave it your all, and you can't always fix everyone. You can't always be the healer, and you should strive to be a patient's coach. And sometimes you lose and sometimes you win, but usually people come out better on the other end for having tried and for having worked. Maybe those patients will circle back around to you in 6 months or a year or 5 years when they come to their readiness to change state. And sometimes people do need surgery. Sometimes people do need other medical professionals' help. They need a service that you can't provide. And being a primary care musculoskeletal provider entails you being able to make that decision when you are not the best person to provide care, and not racking your brain for 6 extra weeks when somebody can't get better and beating yourself up at night because you didn't quote unquote fix that patient. So hopefully you guys can hear the message here and take it to heart and realize that you can't measure your own self-worth or effectiveness of a clinician always by the outcomes of your patients. So if you guys have any comments, post down below. Thanks.